first line of introducing Ayurveda is very important. That is, Ayurveda is ancient Indian medical science. The intention behind saying that medical science, that one should not take it as just as a medical such some health products, because most of the time Ayurveda has been presented as some of the products like amla juice or chawanprash or any supplements like ashwagandha. So it is not just a product, but basically Ayurveda is a complete medical science. It has its own language, because every medical science is based on some philosophy and its own language. For example, modern medical science is based on the basic language of cells and the related part of the cells. So the basic functional unit is cells, and on the basis of that, the entire science has been created. Likewise, Ayurveda is based on its basic principles and the laws of nature. Um, Functional units of it is Vata, Pitta, and Kapha. So you can also correlate it with electron, neutron, and proton in the modern science. But basically, all that is formed on the basis of the laws of nature. Now, when we speak about the law of nature, that becomes, that means it's all about the basic elements, that is ether, air, fire, water, and soil. So, whatever are the basic principles are of these in the nature, the body is also made up and formed with the same laws. So that is why whatever is happening in the outer world, the same thing happens inside our body, or in the inner part of the body. So on the observation of this nature and how the things are going on, for example, sometimes there would be heavy rain, sometimes there would be drought, sometimes it would be too hot summer. So all those changes, how it happens in the outer world, the same thing happens even in our body. So looking at these things, Ayurveda is based and formed. So it has its language is Sanskrit. So it has been written in the ancient language of Sanskrit. It has its own diagnostic methods. And for example, you all must be knowing about the pulse diagnosis. The pulse diagnosis is just one part of the entire diagnostic, various diagnostic methods. Apart from the pulse diagnosis, we also have to check the abdomen and the status of the abdominal organs, how it is, functioning. Again, we have to take a detailed history of a patient, what is going right, what is wrong about the diet, lifestyle, the past illness history, everything we have to take into the consideration in detail. And then we have to come to a conclusion of the diagnosis, and on that basis we have to do a perfect uh, diagnosis based treatment plan. So this is the way any kind of medical science does work. Ayurveda does work in such a systematic way. So the most important difference, I could say, between the Ayurveda and allopathy or any other kind of pathies is Ayurveda always try to find the root cause of any problem, and it tries to treat the root cause of that problem. So once that is rooted out, so disease would be completely finished out of the body. So I think this is enough as an introduction if this is understood.
That's great, thank you. So does that mean Ayurveda is only for healthy people, or do you treat diseased people too?
Of course, Ayurveda is meant for, has given equal emphasis for treating healthy individuals as well as treating various kind of diseases. And accordingly, they have given various treatment modalities. Like suppose for an healthy individual, they have given these important things like dinacharya. That means how our daily regime has to be, how our daily schedule has to be. What are the things we should do to take care of our health? I can give a simple example of that. For example, it has been mentioned in Ayurveda that every person should do a massage with oil on their own. So that has to be a part of daily regime. So massage is not something that which should be done once in a while, but because of the modern lifestyle, people are unable to do that every day. But I can say that whenever it is possible, one should do massage. If it is possible to be get it done from somebody else, that is okay. If not, one should do it on their own. So that is one example. There are so many such things which are incorporated in our lifestyle. Apart from that, installation of oil in your ear, installation of oil in the nose, oil cooling, then putting some medicated ghee or some cream in your eyes so as to take care of your vision and health of your eyes. So there are so many such things. Even taking care of the joints, massaging to the joints and strengthening. So exercise is one important part. So, but that is about the Nicharya. And then Rutucharya, that means as the season changes, as we enter into the summer and then winter and then monsoon in India. So accordingly, the way we change our clothes, we should also change our diet, we should also change our overall lifestyle. So there has to be change in as per the weather also. Then, for the healthy individuals, Ayurveda has also recommended Panchakarma, that is detoxification, which we are going to talk about in detail. Then Rasayan and Vajikaran. That means the things or the medicines which are helpful for overall improvement of the immunity and the endurance. Apart from that, the Vajikaran is also meant for the maintenance of the genital health, or we can say the sexual health also. So Ayurveda has given a lot of importance to these parts, uh, taking care of the immunity as well as the sexual health. And last but not the very important thing is Sadvrutta, that is taking care of our mental health, has to be a part of our, day-to-day life. It is not that once in a while I get time and then I am doing meditation. That would not give you support for, for a week or something like that. So it has to be a part of every day, and that also includes how we should behave socially. What should be the social etiquettes, the meditation and peaceful life, how we should learn how we should live peacefully, because it is always said that anger is spontaneous and peace is a choice. So it has to be a choice always. And at the end of the day, the most important thing is about spreading love. And because everyone is hungry for nothing but the love, and everybody wants the love. So if there is love in our life, in the society, in everyone's life, so everyone would be the most happiest people and the country, I would say. So this is whatever I have said so far has been written exactly in Ayurvedic classical texts. I'm not saying anything out of my mind. So likewise, yeah.
I was just going to ask, how long ago were these texts written?
Oh, uh, approximately, people say that it has been written somewhere around 5,000 years back. But I would say, forget about how many years back it is, but it has been written in the era where there were no temples. Because in Ayurveda, there is no reference of any temple. Second important thing is Ayurveda has been written. It is not a Stone Age science. It has been written when a human being was completely cultured, because he used to wear good clothes, he used to wear ornaments, he used to use the vehicles like elephants and horses. So it is written in that era, when the person was cultured and civilized, and he was knowing the art of language and writing also. So that is why it could be manuscripted in the ancient days. So whatever it is, but nobody knows the exact source or exact time when it must have been written. It is so ancient.
Okay, that's great. What kind of treatments Ayurveda has? How is that different from other pathies?
Right. I mean, before that, let me complete one important thing that, as I
Sure.
mentioned about the healthy people, how healthy individuals are supported with the Ayurvedic treatments. Likewise, even for the diseased people, Ayurveda has its own modality. And I'm going to, introduce this because out of this, we are going to talk about one modality today. First thing is detoxification. Second is oral medicines. Like in allopathy, there are we consume tablets, syrups, capsules. In Ayurveda also, there are tablets, there are capsules, there are powders, there are ghee, medicated ghee or medicated oils. So there are so many forms of medicine, decoctions, which are made. All the medicines are made out of the natural things like herbs, herbal things. And then very important emphasis is given on the dietary part, what should be eaten, what should not be eaten, and that has to be very much individualized. That cannot be generalized at all. Then lifestyle management. How our life has to be according to our occupation, where we are living, in which country, what is the weather outside, and what is my body type. There are so many aspects has to be considered when I have to decide my lifestyle. And if something is going wrong, that has to be, corrected and managed well. That plays a lot of importance in maintaining our overall health. And of course, the very famous thing worldwide is yoga, which is a complementary science for Ayurveda, because both these sciences are evolved from the same basic concept, and of course the exercise, and at the end the mental composure. All these things, whatever has been mentioned here, that becomes a treatment modality for every disease. Just oral medicine or just the detoxification, just diet, just yoga are not sufficient in most of the cases while treating a disease. In a healthy individual, that might be sufficient, but for disease, we have to take help of all these things. Yeah.
Okay, great. Thank you. Talking about detoxification, what is the concept of detoxification as per Ayurveda?
Yeah, that is, as per these various treatment modalities, one of that is detoxification. Let it be very clear. So let us go in deep about the detoxification methods. This detoxification, entire process or the concept of detoxification is called as Panchakarma. Now, the Pancha means 5 and Karma means procedures. So they are most importantly, 5 main procedures which causes the detoxification or which detoxifies the body. And there are 2 more important procedures which are prerequisites of these Panchakarma. So they are namely Vaman, Virechan, Basti, Nasya, and Raktamoksha. Now, first thing, let us understand why there is a need of detoxification. Basically, when a disease process happens, a pathogenesis happens in the body, some external things, or some things even internal, gets mixed with our internal organs or the part of the body, and they try to spoil the internal part of the body. And whatever is spoiled, that cannot be again converted into a useful part. So that is why it is very much necessary to convert those spoiled things of the body into such a material or such an object which can be excreted out. So for that, first we need that preparation of the body and convert these toxins into a form which can be excreted, and then it has to be expelled out. Now, how it would be expelled out? It can be expelled out through our natural orifices of the body, like nose, mouth, anus, penis, or vagina, urethral opening. These are its natural orifices from where the toxins can be excreted out of. Apart from that, there are no other options body can excrete, and most importantly, the sweat or the perspiration, how we do. So these procedures are becomes the first important aspect of any treating, while treating any kind of disease or maintaining the health, because once the body is cleansed completely, then it is very easy to, I mean, give a strength, a strengthening, or any kind of immunity building, whatever we want to do later to that becomes very easy.
Okay, thank you. What method of Panchakarma, what is its procedure that you would use for each of these?
Okay, so as I mentioned that before going to the Panchakarma, so we first have to do two important procedures, which are called as prerequisites. That is nothing but the Snehan and Swedan. In a very short, if I have to explain the Panchakarma, that is detoxification procedure, how it happens, it is very easy to understand. If you know the traditional method of washing a cloth, like first soak it in a hot water, put some detergent in that, soak it for some time, and then you apply a soap, brush it, then rinse in a clean water again, squeeze it, and then dry it. So Panchakarma is, these detoxification processes are exactly the same procedure. So initially we have to soak our body and loosen up the toxins, and for that the most important two procedures required, that is Snehan and Swedan. So in the Snehan, overall the oleation, or you can say a lubrication of the body is done, and then the Swedan is nothing but the hot fermentation in various forms. And once that is done, the toxins of our body get loosened up. And once that is loosened up, that has to get dissolved in some media. And whatever the oleation, lubrication we give to the body externally or internally, in that media, these toxins get dissolved. And because these are the fatty acids and the fats which creates the media in the extracellular fluid of our body, in that the toxins gets dissolved. And when we do the detoxification, these extracellular fluids are brought into the circulation, and that is secreted into the gut. And once that is secreted into the gut, then it is expelled out through the various procedures. So that is why it is very important to understand the basic principle and the process, how it works. So there are various kinds of oleation and lubrication process and hot fermentation process. I will just go through that. See, these are some of the pictures of those procedures. Like we do oil massage, we even do bathing with the oil, complete body or part of the body. We do shirodhara, that is pouring of oil on the body. And then various hot fermentation methods, like you can see the potli. The potli means a bunch of a bundle of leaves or some medicated herbal powders, or it can be medicated rice, which is dipped into milk, hot milk, and then massage. And the very known procedure about the steam bath. So likewise, there are multiple things in which various medicines are used. So there are some decoctions also which are used for the bathing. There are some fermented decoctions. Likewise, there are some medicated milk. So there are various medicines which are used for the hot fermentation. So initially we do the oleation or the lubrication with the massage, and then we do hot fermentation. This becomes the prerequisite for almost every Panchakarma or detoxification treatment. But apart from that, one more important thing, which is internal lubrication. And it is done by drinking some of the medicated ghee or medicated oils. So as we do the lubrication and the oleation with the massage, in the same way, it can also be done internally. But the requirement of that changes procedure to procedure. In some procedures, the internal lubrication is not required, and in some, it is very much required. And then, as I mentioned, these toxins are removed either by inducing vomiting or by inducing a purgation, that is virechana, then by basti, that is giving enema, or by nasya, by installation of some oils into the nostrils, or rakta mokshana, that is bloodletting. So these are the 5 important panchakarma or detoxification process around which those other therapies, external therapies like massage and the hot fermentation revolves around these 5 important procedures. So when we do these procedures, either it cannot be done all together. I mean, if I did Vamana today, I cannot go immediately for Nasya tomorrow or Viration day after tomorrow. It cannot be done in a sequence. There has to be some interval of time if we are doing a complete detox process. But if we are doing a part process of that, I mean, if I'm giving a purgative medicine without giving any kind of lubrication, then I'm definitely able to do the next procedure like basti and all. But there has to be some sequence which is decided by the doctor after assessing your health completely. And there has to be an interval as well as the duration also for every panchakarma. Yes, I think this is the basic and brief information about the process of detoxification. Anything else?
I think you've just led me on to a question there, asking about what precautions are needed during Panchakarma, and you're saying that as you go through, it's changing according to the patient.
Right.
So I take it that's because of the precautions that you're working with and changing the patient.
Right.
Okay.
First thing, let us understand why these precautions are need to be taken. I mean, why you cannot take it very casually. You can just go to the clinic and do this thing, do the Vamana to me today, and I will have to go for a job now after an hour. So that all that is not possible because all these, when we do the detoxification, we are playing with the gut, and the medicines which are used for the cleansing, they are not just cleaning up your gut and the digestive system, but as I mentioned earlier, they do act, they do penetrate into the circulation, they do collect and all the toxins which are again brought into the circulation, that is again brought to the gut. So when the circulation is involved, you can understand the heart is very much involved, the organ heart is very much involved in this. And that is why all this has to be done very much, very carefully, because your entire digestive system, your heart, as well as the entire circulatory system, nervous system, hormonal system, everything gets involved in this while doing this process. And that is why it has to be done very much under observation and very carefully. the special precautions which has to be taken during this process is first and very important thing that uh, one should not select that I want to go for Vamana or I want to go for Virechana and let us do this. That should not be done. Let us assess and screen your health with an Ayurveda doctor first, and let the doctor understand what is the status of your health. And on the basis of that, which Panchakarma, which detoxification process is really necessary and suitable for you. Both has to be understood very well, and then the program has to be decided. That is the first very important requisite. Second important precaution to be taken is about the diet and of course the lifestyle. What kind of diet you should follow during the Panchakarma is decided. The protocol has been given in detail in Ayurveda. So basically, the basic principle behind that is the diet has to be very light to digest. It should not be complicated. And that again, if anything causes the indigestion, and again the indigestion causes any complication, that should never happen during the process, because the gut is involved and gut is a bit sensitive during that, and that is why it is not able to digest the heavy food and whatever junk food. So that is why the diet which is given by your doctor has to be followed very strictly. That becomes very important thing. In that part, one very important thing is about drinking warm water or the hot water. Sometimes doctor will tell you to drink hot water, sometimes it would be warm water, but most of the times drinking normal water has to be avoided unless and until we are doing or conducting these procedures in the peak summer season. Otherwise, warm water is a very important precaution. And then in the lifestyle, one should avoid doing any kind of exercise, any kind of physical exertion, late night sleeping, any kind of sexual indulging into any sexual acts. All these things are very important to be noted. In that, one should also keep yourself very calm and composed mentally. I mean, if there are some situations where you have to be very angry or your mental composure is not getting balanced, you should not get indulged into such things during these procedures.
How long would these procedures last?
Okay. That differs from procedure to procedure. I mean, for example, if we are doing Vamana, it requires around 13 to 15 days from the day we start and where the entire treatment ends. But when we are doing the procedure, you will remain somewhere around 8 to 9 days. And other days are required to follow the diet regime. It is same with Virechana also. It is same with Nasya. It is 7 to 21 days required, depending on the severity of the illness. And if it has to be done for a healthy individual, it is required generally for 7 days. Now, Raktamokshan generally needs 7 days. And in some cases where the local Raktamokshan has to be done with the help of leeches or cupping, that requires 1 day in a procedure, but that has to be done repeatedly as per the requirement of illness. But the most important thing is about Basti. My eye has come down. So Basti is known as the half of the treatments. I mean, if Basti is kept on one side, all the other treatments like Vaman, Virechan, Nasya, Raktamokshan are on the other hand. So it has given such an importance because it does, it can balance Vata, Pitta, and Kapha, all these three. Whereas Vaman and Virechan are meant for Kapha and Pitta, not for Vata. But Basti can treat all these three doshas. Second important is Basti controls the Vata first, and Vata controls the entire activities of the body. So that is why Basti becomes so important. Basti also acts on the nervous system. Now, you will say Basti is nothing but giving an enema. The medicine of the enema will reach to rectum and the large intestine. How it is going to act on the nervous system? Because there is a complex plexus of the nerves in the large at the end of the large system in the rectum. One. Second is from there the hypothalamus can be activated, and once the hypothalamus is activated, the entire nervous system, central nervous system, can be controlled, and that is how it gives the signals to the various functioning organs, and then organs start functioning well, secreting well, and then the system and signaling of the body starts getting in a normal way. So that is why Basti has been given a lot of importance, and uh, the duration of the Basti is minimum, you can say 15 days to around 45 days. It has been mentioned to be done. In severe cases, like in the cases like stroke, paralysis, we do Basti for continuously for 100 days. So that is the number of days we require, but that 100 days in those cases are not done on everyday basis. We have to give some pause of one day or another other day. So likewise, we have to complete the 100 Basti. So this is about the, as you asked, the duration of the Panchakarma needed.
That's interesting. Which disease conditions would Panchakarma be required for?
Yeah. I mean, if you ask me in other words, like which are the diseases can be taken care by Ayurveda, it would be the same answer.
Okay.
Because in almost every disease condition, Panchakarma is required. I mean, the first line of treatment of any disease has been mentioned is Panchakarma, and then the other things are told. So Ayurveda has given the treatments for right from a simple cold, cough, and a fever to the management of the cancer. So you can imagine the width of the kind of treatment and the diseases we can manage. So, for example, let us consider which are the frequently, I mean, which kind of patients we get in general in our OPD. Autoimmune disorders like joint disorders like arthritis, skin disorders like psoriasis, gut disorders like IBS, liver, autoimmune lung disorder, liver disorder. So various kinds of autoimmune disorders are very much treatable by Ayurveda. Then degenerative bone and joint disorders up to the level of grade 3. I mean, when joints are degenerated, but they are not yet touching each other, till then it can be treated. But when the joints are touching each other, rubbing on each other, in that case, it is not treatable with the Ayurveda. In some cases, it is treatable with the help of the yoga. But again, I would say that is a surgical condition when the bones are touching on each other, completely doing friction. So that is a surgical condition. Apart from that, these degenerative cases like cervical spondylosis, lumbar spondylosis, osteoarthritis of the knee joint, these arthritis can be very much treatable. Then various kinds of digestive disorders, right from simple hyperacidity to the IBS kind of thing, then hormonal imbalance leading to obesity, diabetes, PCOS, all these things. Lifestyle disorders like hypertension, stress management, as well as the treating the psychological condition. But again, there is a limitation in treating the patients of complete psychosis and I would say schizophrenia are not treatable with Ayurveda. I mean, maybe treatable, maybe some people must be treating, but I have not yet heard who is doing that. And
Okay.
the very important thing about getting rid of the addictions, Ayurveda has given one entire chapter on that called as Madatya to get rid of the various kind of intoxications. And then gynecological disorders like sexually transmitted diseases as well as PCOS, and obstetric care like antenatal care, postnatal care is also very much possible, and we are doing that successfully in so many cases. So far, we have treated, I'm happy to say that we are parents of around 56 babies. So we have treated around 56 cases for the antenatal care and postnatal care with Ayurveda.
That's beautiful.
And then cancer management, we are doing the management. I'm not claiming that we are treating the cancer, but because in some cases surgery is not possible, in some cases the treatment is also required along with the chemotherapy and radiation to get rid of the various side effects of that. And post surgery also, some sort of treatment support is required so as to get rid of all those toxins which are ingested in our body in the form of chemicals. So that kind of cancer management we do, and is possible with Ayurveda. And the skin and beauty care, hair care, that is also has been given in detail. While speaking, I think I have also spoken about the limitations, what we cannot, but most importantly, the acute management or the critical management of any disease we are not doing at this moment in the entire Ayurveda industry. That is not yet too developed at very large extent because we don't run a critical care center like ICU and all. So that is our limitation. Surgery is our limitation. Apart from that, everything is our scope.
So you would work hand in hand with the allopathic as and where required.
Yes, I mean, that is hand in hand is one thing, but we expect more than that. I will let you know that.
Okay. So once someone's gone through the Panchakarma and the detox, whether it's for disease or whether it's for their own personal yearly detox or whatever it may be, how do they maintain the good effects from the Panchakarma?
Okay, that's really very important to be known. I mean, maintenance. I mean, once we do this cleansing process, don't think that now we are cleansed and now we will be completely healthy. Nothing can touch us. It is not possible. That has to be maintained very well with the help of right diet and right kind of lifestyle, which has to be individualized, which has to be understood from your doctor. Secondly, there are some rejuvenating medicines, as I mentioned earlier, which is called a Rasayan and Vajikaran. One famous example of that is Ashwagandha and Chyawanprash. But that is not the only thing. There are so many such medicines which has to be decided. I mean, which medicine has to be consumed by whom on the basis of our body type and multiple factors, which has to be done by the doctor, not by I mean, on our own. I mean, I have seen a lot many people nowadays consuming ashwagandha very blindly, everyday basis. But I will tell you one thing about ashwagandha. Ashwagandha is basically meant to enhance the male hormones in the body. And if that is consumed by the female, it is definitely going to cause some hormonal imbalance in coming time. It is not just an immunity enhancing medicine, but it also acts on the genital system. So my sincere request to everyone is do not, I mean, follow these blindly, this thing blindly on seeing on the internet or the WhatsApp messages, because that can become very dangerous. And then you won't come to know that, because that is very slow acting thing. I mean, if something goes wrong after 3 years or 5 years, you won't be able to judge that by which reason this thing has happened. Yeah. And then, of course, the yoga and exercise is very important in a every day-to-day life. If that is followed, I mean, complemented our overall this thing. So one day will come, then you might not require the medicine to maintain the health. You will just getting maintained just with the yoga and exercise and diet lifestyle. That's
so a routine and good health is created. Who would you recommend embraces Ayurveda and Panchakarma for their health?
Okay. Before that, I would like to tell something about the medicines which are used for Panchakarma. I mean, why I want to tell this is because Ayurvedic medicines has a lot of importance while doing the cleansing process. I mean, cleansing process, the procedure has its own importance. At the same time, which medicines are used for doing that cleansing process becomes very important. On the basis of those medicines, the output of the entire process depends a lot. So these are the very common medicines like Dashmula, Triphala, Trikatu, Madanpal, Trivrutta, Erinda Taila, that is castor oil, Anu Taila, and Guduchi, that is Tinospora cordifolia. Tulsi is also one of the, I have missed writing that. So these are the very important medicines. I mean, these are nowadays available even in the market. So one should be knowing about. Before going to your question about who should do this, let me go through this first. So how this benefits, and then you will understand who should get it benefited from. I mean, first very important thing is Panchakarma maintains overall health, keeps us disease free and energetic. So that is one. Secondly, it is a very important procedure to restrict our aging process, and that is how it maintains our hair, skin, as well as it restricts our wear and tear of the body. So because it does a very proper lubrication of our body, I mean, in a balanced way. It doesn't lubricate excess or less. It nourishes our sense organs. Can you imagine? I mean, in the ancient time when there was no innovation of the specs, how people must be living, how they must be reading without specs. So these are the very simple techniques how we should take care of our sense organs till the end of our life. We should be able to have a good vision, sense of the smell, taste, everything. And our skin has to be very sensitive too. So taking care of sense organs becomes very important. Then uh, it also helps us keeping hormones and the nervous system very healthy, which is very important. It maintains the weight of our body. It helps you to shed some of the weight, gain some of the weight whenever it is required. It keeps you emotionally very positive and composed. Helps you for, and that actually helps you a lot for the addiction, because see, at the end of the day, it's a game of chemicals in the body. There are a lot many chemicals which are acting on your body as well as mind. So once we do the cleansing process, a lot of things changes in the chemical level, and the chemical which creates generally negativity are cleansed out, and the chemicals which are creating positivity are generated and secreted, and that is how it helps you a lot to get detached from any kind of intoxications. And it is very I mean, Ayurveda has emphasized a lot on the sexual health, and it keeps everyone healthy for long duration and maintains the sexual health for the long time, for the long years. Yeah. And yeah, hope that makes clear. Is there anything
Yep.
you want to ask?
Are you happy for us to go on to the questions from the audience?
Yeah, I think I have touched these points, but in a nutshell, let me summarize these things. Like
Sure.
these detoxification processes, if they are done properly in an authentic way, that helps a lot to maintain the healthy life. I have shown the photo of the elephant there purposely because you can take an example of the elephant, how it is. Elephant is a intellectually very sharp animal. Elephant is a very, I mean, powerful animal. Animal. It is it lives at least for 80 to 100 years, long years, right? And apart from that, it is a vegetarian. I mean, being vegetarian, it can sustain for long life. And the animals like which calls themselves king of the jungle, like tiger and lion, they live for a very short time, for 15 to 20 years. So we should live like elephant, and that is why in Indian tradition we have god with the face of elephant, which is named as Ganapati or Ganesha. Uh, as you asked me before this, what is expected from the audience and the people, it is not just that they should follow Ayurveda hand in hand, but I would suggest Ayurveda has to be the first line of treatment for everyone. And if something is not getting solved with Ayurveda, then only we can turn up to the allopathy science. Till the time we don't need allopathy science, we should not get into that to stay free from the chemicals. And let us make Ayurveda the first line of treatment. That is my dream and goal, to make the world, chemical free first. And then mental health has become very much important nowadays because of the stress which is going on everywhere. Addiction free life, one should learn for that, because enjoyment for any kind of like smoking, alcohol, or these things is okay once in a while, but it should not become addiction, and that should not take over your entire life. So it is very important. And then all this is meant to increase the happiness index of our life, and which at the end of the day, if we ask how was your day, I should say it was very happy. So that is the entire goal of Ayurveda also. And if that is done, if somehow I'm happy with the health, with the wealth, with the amount of time I'm having, with the relationships I'm having, and at the end, uh, the achievements, whatever I wanted to do in my life, that is done. If all these five things, pancha, five things are achieved, then we can say we are the richest people in the world, isn't it?
Very much so, without a doubt. So, I hope I'm not blocking any information here. So let me just bring up the questions. So, how do you choose the right medicated ghee for your eyes? What do you look at exactly to justify the quality and safety of the product? And this is from Shivani. I hope I've pronounced that correctly. I'm sorry if I haven't.
Yes. Yeah. I mean, to take care of health of eyes, we do one procedure which is called as Netra Tarpan, and in which the ghee is and the pooling is done of the medicated ghee on the eyes. So now the right kind of medicated ghee is chosen by the doctor on the basis of the assessment of your body type and the kind of dosha, that is whether it is vata, pitta, or kapha, which dosha is exactly causing a problem to your eyes. So, for example, if your eyes are having a blurred vision, and if it is having association of kapha dosha, so I have to use Trifalagruta. If it is Pittaj, then I have to use Tiktagruta or just plain cow's ghee. And in Vataj conditions, I have to use Dashamulagruta. So likewise, on the basis of the underlying dosha, which is disturbing your health of your eyes, I have to choose the ghee. And hygiene definitely becomes very important while doing the process. That is one. Secondly, all these ghee are, when it is processed, they are very much boiled. They are boiled for at least 3 to 4 hours continuously. So you should not be worried about the infection spreading through the ghee. That is never possible because it is boiled so much. Then that is packed well in the airtight bottles, and that is used. And while doing the procedure, according to the underlying dosha, if it is kapha dosha, so ghee is made little warm. If it is vata, it is warm. And if it is pitta, the room temperature ghee is used. So this is, I think, uh, satisfies your answer and question.
Excuse me. Okay, I'm sure she'll raise it again if we have more information that's needed. Anita's asked, what types of oil can you use? She has very sensitive skin. Is linseed flax oil okay for inside and out?
Flax oil for consuming?
I'm presuming for busty and for on the skin directly.
Okay. Yeah. I mean, in Ayurveda, the most important oil is sesame oil. In any cases, sesame oil is the best oil for the application as well as for the internal consumption. Uh, Other oils like flax oil, or I could say olive oil, or any other oils has their own rules. But instead of that, Ayurveda has made some medicated oils with the base of the sesame oil. So when we medicate that oil, so that is again categorized into Vata, Pitta, and Kapha. If your skin is too sensitive for something, so that would be sensitive either for hot potency oils or for cold potency oils. So that is according to the underlying condition, we have to choose the medicated oil which will pacify the vata, pitta, or kapha. If your skin is impacted or affected by pitta dosha, so we have to use medicated oil which can pacify the pitta. So this is a concept of Ayurveda. But in general, if you ask me, in a day-to-day life, if somebody want to get the massage done, so sesame oil is the best. In the countries like India, where the summer is very hot, or the Mediterranean countries where the summer is very hot, in those summer days, coconut oil can be used for the application on the body. But in the countries where it is a cold weather, one should not use coconut oil for the body. It can be only used for the head.
Okay, that's great. Thank you. Shivana has asked another question here, which is excellent. Can you please explain the process you highlighted initially regarding the movement of fatty acid molecules to the gut, where it gets expelled out, the detox process at the cellular level?
Okay. In a brief, I can say that when we do the internal consumption of medicated ghee, that is generally given early in the morning, where your digestion process is started yet. So at that time, as soon as you get up in the morning, at the time of sunrise, the loading quantity of the medicated ghee is given. That takes around 12 to 14 hours to get digested. So such a slow digestive process in a whole day, that doesn't help those fats to get converted into the fatty acids and the adipose tissues, and that is fat of our body, that just gets absorbed and remain in the interstitial fluid as a fatty acids. And because our cells and the wall of the cell is formed by the fatty acids only, so its interaction with the cell become easy, because fat can interact very easily with the fat. And that is why the toxins which are inside the cell can come out and get dissolved, mixed with these fatty acids, and then it can be brought into the circulation and to the gut. This is in brief I can tell. In detail, I need some more time. And when we do the lubrication from the dermatomes, when oil enters into the pores of your skin, so gradually, if you would keep on rubbing it, the dermatomes, which are the nerve endings of your body, gets activated, and from there the absorption process of the oil starts. And it has been given in Ayurveda very specifically that how much time you should do massage to one part of the body, which will take that or penetrate the oil at what level. Yeah.
So even a massage is scientifically broken down into the relevant detoxification.
Yes, yes, of course.
It's fabulous. Further question from Shivani. What is your take on the use of Rhodiola Resea in anxiety?
Pardon, I didn't get it.
Rhodiola or Rhodiola, Rhodiola, Resea, used in anxiety.
Is it a modern medicine molecule? Oh, I have to go through that, how it is working and all. I cannot comment on that at this moment.
Okay, we can put that and then respond once you have further information on it. Okay, Shivani, if these herbal components are heated for 3 to 4 hours, would it not lose its properties? Any imp components during the heating process?
While preparing the medicated ghee and oil, you mean to say?
Yes.
No, I did not mention the detailed procedure of that. I just, just for the sake of understanding whether there is any possibility of spreading the infection through the bacteria or something like that. I just mentioned that, but it is a very scientific method. So, that has to be explained in detail if you have to understand that.
Yeah, how
it is not just the boil.
No. And that's the end of the questions. Anita says thank you. She has found that she can't actually use coconut oil, and she finds it quite interesting about the climate and the differences of the oils and their impact on each of our bodies. So if no one else has any further questions, could I ask, as we finish, what some of your key takeaways and final thoughts are for our audience?
Yeah, as I mentioned earlier, my final this thing would be, this is just about detoxification we spoke today, and that too very in brief, because it would take a lot of time to get into the details of every procedure. That also is possible in coming time if we go on choosing a webinar on one particular detox process, and then gradually we can come to how the internal medicines work, and what is the importance of diet, what is the importance, and how the lifestyle has to be. So in future we can think of a series of such webinars. But in a nutshell, I would say again, let us make the world chemical free, and let us make any natural kind of treatment or the therapy our first line of treatment. And of course, the modern technology and the modern medical world has given us a lot, and really hats off to them for giving us such a important critical care in our life. But I would say, let us do something so that we would not get landed into such a situation in life that we would require the support of the allopathy system. So that is the success of Ayurveda and any other pathies. So my sincere request to everyone to start following Ayurveda from yourself. And for that, if somebody can start from the day regime, that is dinacharya, and then gradually one by one, if you understand the concepts in detail and then start following that, do not please follow blindly anything on the advice of the non-qualified people who doesn't know much in depth about Ayurveda. Please don't do that. That would be my final advice. Thank you so much.